Thank you for staying with us. Health and Lifestyle begins right now. Today we want to talk about lupus as we create awareness around this condition that mimics almost everything. And people who are warriors, they will tell you the journey and how long it takes for one to get just a diagnosis, and how that also becomes another face of a journey as well. But who am I? You know, I can't speak for them. In studio this morning, I have with me a lupus warrior and a rheumatologist. They're going to shed light on, you know, this particular condition. I'm talking about Winnie Opondo. Winnie is at the center there, the warrior herself, lupus. I wish ningekuwa na drums. Yeah. Thank you so much for creating time, Winnie. It's always nice to have you. And of course, we have with us Dr. Beryl Ganda. Dr. Beryl is a consultant rheumatologist. Asante Daktari for creating time.
Thank you.
All right, so let's begin quick from the very basics, Daktari. Let's break it down. Let's not assume that everybody knows what lupus is. What I know is you cannot even know that somebody has lupus by looking at them. In fact, you can not even know that they are sick. And that is also another problem. So let's begin there. What is lupus?
Thank you. Thank you for having me here. So lupus is a complex disease. Quite a complicated disease, very difficult. As you have said, you can look at somebody and not know that they have lupus. But lupus is a disease where your body launches a fight against itself. You know, our bodies are made with protective mechanisms to protect us from germs, from toxins out there, and that is what the work of the immune system is supposed to do. So in lupus, what happens? Your body starts to identify itself as the enemy. It's like a civil war within the body. So the immune system starts to fight the body cells themselves. And it's quite complex, and it can affect all organs. As you can see, if the body is fighting itself, and it's a civil war within itself, so all organs and any organs can be affected. So that is why it's called autoimmune. It is a fighting self. Yeah, like it's supposed to be fighting the outside enemies, but it now turns around and starts to fight itself, and it's like an aberrant war within yourself, inside the body. Yes.
So can it like fight the organs, you know, you find like your kidneys, the likes begin to get affected? Yes,
lupus can fight each and every organ in the body. It doesn't spare any organ in the body. So it can start from the hair all the way down to all the organs in the body, up to your toenail, can get affected by lupus at any time in the course of the disease. Yes.
Why is it called the greatest imitator?
Well, lupus is called the greatest imitator, the great masquerader, actually. Also the great mimicker, because lupus, as we've said, it can affect any organ in the body, all organs in the body, so it can present like anything. And in our country, most of the time, lupus is confused for infections. Because by the time you come, you're looking sick, fever here and there. Most of the time, you'll find lupus patients who've been treated for TB 3-4 times, have been treated for infections, have been treated for all sorts of diseases before you actually can make a diagnosis of lupus. And that can actually sometimes take a long time if you don't have a high index of suspicion to diagnose this disease. So it's a masquerader, as we can say, yes. Not easy.
We'll get to the specifics on the symptoms and how now then you zero in to get a positive diagnosis and confirm that it's lupus. But Winnie, yours is more of a personal touch. Having interacted with your story, it took, is it 6 years before they got a name to what was going on?
Yeah, you're right.
That must have been quite something. Tell me a bit about it.
It actually, like Doc says, it is quite something. You cannot really pinpoint it. So I think retrospectively, when I look back, it's like it started way back in around 2012, because back then I had a lot of challenges in that I was treating actually infections, like Doc says. 1 minute you're going to the hospital, it is a bacterial infection. Next time, it's a recurrent infection that doesn't go away. So again, I had experienced some signs, which when I look back, I think there were some telltale signs of lupus, because I used to have very, very cold fingers, and my feet were cold. Like when the sun is up, I was in gloves and literally in socks all the time because of cold. And then when they got cold, they got numb, and then they started being painful. So at a certain point, I treated nerve peripheral something. And then I was also treated, by the way, for pneumonia at certain points. A lot of bacterial infection. I had stomach issues that were unending. I remember sometime in 2012, I went to one of the biggest hospitals in Kenya, and we ran a series of tests, including HIV, TB, diabetes.
Just
there was
trying
nothing.
Yeah.
And I remember that doctor telling me something that really broke my heart. That they don't know what is wrong with me.
But you're here, you're feeling unwell.
Yes, and you are always in constant pain. You're always tired. You don't know what's happening. But I think I have seen very many physicians. I have been on a lot of antibiotics. I think those things know me by name. They can actually call my 3 names because I took a lot of antibiotics just to see. At certain points, I think I had to remove 4 teeth at the same time because they were all so painful. Until I think around 2018, that's now 6 years later, when I got that diagnosis. And I actually I had been going to that hospital several times, treated for different things. So I think one of the doctors, after listening to my history, they referred me to a physician. So when I went to the physician, I think he was also studying rheumatology at that point. And I think that was my breakthrough. Because on that day, he took my phone and he took a picture of my face. And then he told me, you look at your face, I had some rashes across the cheek and running over my nose. And he told me those are the signs of lupus, but he didn't want to give me a diagnosis at that point because he wanted us to be sure. So he referred me to a rheumatologist, and that's when I met Professor Omondi Yoyo. But even before I went to Prof, I had a bad incident. I woke up that day and half of my body, like if you draw a line, half of it was in pain. It was in extreme, excruciating pain.
Oh, so
I
you're
didn't
feeling
know.
a very overwhelming pain on one side of your
Yes.
body. This other side is okay.
It was okay. And I had the
So that is what
worst
lupus
headache.
does. It just...
The headache was crazy. I felt like my head was going to fall off at a certain point. I took painkillers, but it wasn't going away. So we had to rush to the hospital. They found I had pharyngitis, and that was what was causing the infection. And I think the doctor said it was something close to sepsis. So it was something that if I didn't go to the hospital at that time, I don't think I would have been speaking here today. So that diagnosis, yes, it gave me answers. I was really happy because at least finally,
There was a name to...
there was a name to whatever it is that was going on beyond, you know, the African witchcraft inclination and everything.
So there was that as well. Tell me more about it. Yeah?
Of
You
course.
can imagine in Africa going in and out of hospital and they're not getting anything.
Yes.
So Africans, they know what is going on.
Yes,
they have a name to
They
it.
have a name to it.
Did you experience
There is a person who is doing it. Your villagers are not sleeping at night, you know, and you're told, try this. In my community, they called prayer men. Go and get prayers from this one. Go and try this
You
one.
went through that.
Yes, we tried everything.
How
We were
was your
desperate.
life before 2012? I want to know, did it just happen, or is it something you had been experiencing even in your childhood, or what these changes? How did they...
No, I would not say it's something that started when I was younger. Perhaps it's something that started around that time, 2012, because previously my life was so active. I was a very bubbly girl all over the place. I was doing stuff, pushing through, building my career. Then the diagnosis came. And of course, it changed me. It changed a couple of things in me, how I look at life, how I, you know, listen to my body. Because then you have to listen to your body if you have a chronic illness. You have to know when to
You
stop.
become more self-aware.
Yes, you have to know when to stop, when to push back and say, no. You can, you know when to say, I need to take a rest.
All right.
Close your computer, take a rest. Shut down everything and just rest. So I am intentional about that.
I'll come back to you just to hear more about that transition and how it was like. But Daktari, there's a lot that I'm picking from what she's sharing. The delayed diagnosis. I want to understand what causes that longevity in terms of many patients getting a diagnosis, if that happens a lot. And also, who is more at risk, what causes it? Do we have answers to those? Because it is still a disease that many people are trying to put their heads around.
Thank you, thank you. That's why we are here, actually, to increase the awareness on this lupus. We do have a problem with delayed diagnosis. It can take roughly sometimes in good centers, sometimes up to 3 years. And in our country, sometimes even up to 10 years for us to make a diagnosis of
10
lupus.
years. You
Yes,
can imagine
10 years.
in and out of hospital,
And
10
not
years,
knowing what the
nobody's
problem
telling you
is.
what's happening.
Yes, yes.
Yeah.
And not to forget that it can actually also start in childhood. All right, so we can still have lupus starting in childhood, getting into adulthood without having proper diagnosis that has been made. But you had asked that what causes this delay. Most of the problem sometimes is lack of awareness. You know, a lot of times you cannot make a diagnosis of what you don't know. So you can only see what you know. So we try to make people more aware about this, and that's also why we are here today, to be more keen to be able to pick out these autoimmune diseases like lupus so that they can know it, increase it in the education curriculum, especially for doctors, for nurses, for clinical officers, and all healthcare workers, so that there's more awareness, there's more high index of suspicion, there's more clinical acumen for people to be able to pick out this lupus. Yeah. What causes lupus? Lupus is complicated, lupus is complex. So as we still do research, what is known now is that you have genes that increase your risk of getting lupus. So you could be born with these genes. Most of the time you're born with these genes, or your genes can just spontaneously change somewhere along your life. So people will ask if it is inherited or not, right? And we would say that lupus can be inherited, but it's not in the classic fashion that we inherit other diseases that is very clear, like sickle cell. We know if your mom has sickle cell, your dad has, then you'll get. With lupus, it can even skip many generations. So it's probably that you'd have to pick a lot of lupus genes from different generations as you go along. So some people will present with lupus in your family, some may not. But of course, if your parents have lupus or a parent has lupus, then your chances of having lupus is higher. etc. If a twin has lupus, then that goes higher, or if a sibling gets lupus, that goes higher. So once you have the genetic predisposition or the risk to have lupus because of your genes, then the exposure to the environmental factors, it's not known at what point this changes. So we have risk factors like the hormonal. You know, most of lupus will come in ladies around 20 to 40 years, and that is the childbearing age. That is when estrogen is at its peak. So that has been found to really trigger these genes, but that's not to say that lupus does not affect men. It does affect men, and I've said it does affect children. Then you have other environmental factors that can actually trigger it, like cigarette smoking, sometimes diet. Extreme exposure to sunlight can actually trigger this lupus. Infections, especially in our setup, infection has been known as a big trigger of lupus, and many such like things. So you can see it's quite complex. Yeah, trying to get what are the risk factors, what causes it. Yeah. But with more research,
it happens more in women than men.
Yes,
but
yes.
it happens in men as well.
It does happen in men.
Just
yes.
more common in women.
In women, especially in the
reproductive
age. Yeah, between 20 to 40. That's the peak. Yes, yes, yes.
Winnie, tell me about the hardest part most people don't see, the silent battle. Yeah?
Yes, lupus is invincible. It means you look at me today, you wouldn't know I have lupus.
Yes.
You wouldn't know that last night my knees were on fire.
Were they?
Yes, but I am here this morning, today, and I have showed up. And that's what we all do.
Does that happen a lot? Like today you're fine, tomorrow you're not? Does that happen to lupus warriors a lot?
It happens a lot, and the challenge about it is that it is unpredictable. You cannot tell when you're about to get a flare-up. Of course, with time, you learn. Like right now, I have learned when I know when a flare is coming up. But sometimes it creeps in so quietly, you cannot tell it is coming. I'll give you an example of what happened to me, I think it was 2 years ago. I was preparing to go for a work assignment. Everything had been done. All plans have been made. Then I go to the clinic and say, because I'm traveling, let me get a refill of my medication so that I have meds when I go out there. Sitting in the clinic, a friend of mine came to sit with me, and they tell me, look underneath your tongue. I had red spots underneath my tongue. I didn't know it.
This happens.
It happens. So I actually, when I went to the labs, because I usually do my labs before I go to the doctor, so after 30 minutes, I get a call from the lab, and they're telling me, we'd like you to come back if you've not gone far. We need to redo another test. We feel there's a problem. We didn't do it. There was a mistake. So I go back, and they tell me that my platelets are pretty low. The platelets are around 12. I understand, I think Doc can clarify, it's usually between 150 to 450. That's the normal range. Here I am walking with under 10 platelets.
That's not a good thing.
Yes.
That's not good.
And so when I go to the doctor tells me, you have to cancel everything. We cannot allow you to even step out of this place. And I get an admission. My platelets were being depleted at a drastic rate. They were going down each and every minute. I think the second day in hospital, they had gone down to 4. And so
From 10 to 4?
Yes, the nurses are coming. They're looking at me like, I wonder, who is this? You're here. Because I'm all bubbly, I am chatting, they come in, you know. And so you see, it is this that makes lupus very difficult because it is invincible. You cannot see until I tell you that I am going through something. You know, and that's when I learned that you can actually donate platelets, by the way, because I got an amazing person who donated their platelets. So that challenge of the invincibility is one big
The reason
issue.
why I took you to that space is because I want to understand how then that affects the response and the level of support you get. Because it's not like any other disease that you'd actually see and tell that this person is not okay. In fact, what I've come to learn, the little I know about lupus warriors, they are silent warriors. Like that pain you will, you know, weka uko ndani.
Yes,
you know.
yes.
How does that affect how people support, how people come around, how people, you know, that silence that the disease comes with?
I think because of its invisibility, there is a lot of stigma. And we mask it a lot because we fear the stigma, the discrimination from people, because 1 minute you are okay. It is so unbelievable that I am here, okay, and the next minute I am in the ward.
Yeah.
10 days, 14 days in the ward, yet I was looking okay. So sometimes you find people look at you differently, like, okay.
Make me believe.
We don't believe you. What do you mean? You know?
That you were okay a few minutes ago.
Exactly.
You were okay yesterday.
Exactly.
So, if you're employed.
Oh, yes, yes.
Yeah.
And by the way, I think I'm lucky I have a supportive employer. So at least when I shared this with my supervisor, I mean, the adjustments had to be made. Of course, the work had to continue. But you see now, that needs someone who's understanding. If you find people who are not understanding, and I am lucky to be part of a support group, and in that support group, what you learn is that there are partners, spouses who have actually separated from their people because they have lupus. Because honestly, someone will think either you're lazy, you're looking for attention, or you just want to be treated differently, which is never the case. Because what we are battling is sometimes so heavy. And because, you know, lupus is lifelong, it's chronic. I'll live with it until maybe the day I die. And so, you know, again, there's that fatigue. Because you're always sick, 1 minute you're sick, you're not sick, you know.
I think in and out of hospital,
Exactly.
the meds, you become fatigued with it. We'll talk about what you really want as lupus warriors and what the ideal environment would look like. But before we get there, Daktari, just run us through that diagnosis. Is there like a specific test that is done, or it has to be like a cocktail of so many factors and so many things to really confirm? And what do you do after that? Do we have types of lupus? What do you do now post the diagnosis?
Thank you again. To make a diagnosis of lupus is, as we've said, it's a cocktail of things. First, you have to have a high index of suspicion. You must think about the possibility that this could be lupus, right? So your clinical acumen has to be high. And yes, we have to combine symptoms, signs and symptoms. You have to combine lab tests. There are a lot of things that you have to put together and be the one to actually put your foot down and say this is lupus, because still along the way it can be many other things that need to be ruled out, right? So in terms of symptoms, they usually have issues like weight loss. I'll just say common ones, but as I've said, every other system can be affected at any time. So weight loss, fever that cannot be found, what is the cause? They have loss of hair, that of unknown cause. You have mouth ulcers on and off, not always all the time. A lot of times you'll have, if they're once getting children, early pregnancy losses in the first trimester that are recurrent. They have problems with blood clot problems. They have a skin rash like what she had alluded to, and most of the time you'll have this skin rash in the sun-exposed areas, a lot of times around the cheek, and sometimes it can have come at some point and gone away, and probably it was forgotten. So they'll have problems with their blood, like the platelets may be low, they might have problems like anemia. So it's a myriad of symptoms and signs. And then when it comes to lab diagnosis, there are tests that we do to try and confirm that this is lupus, other than general body tests, you know, because we have to check all organs and all functions. We have tests like the anti-nuclear antibody that we normally do, and this is the test that checks, as I told you, it's the immune system that's launching a war against itself. So it normally goes for the nucleus of most of the cells. So that's why we check these antibodies that have been formed against the nucleus. And then we can even expand it to have something that is called extended nuclear antigen antibodies. Those now to break it down into very small, and these are not cheap tests, by the way. And
then
then
cheap.
Yeah.
How cheap is cheap? You know, cheap for you and cheap for me.
No, it's generally a problem, as I would say. That is one of the challenges.
The cost.
Yeah, the cost is one of the challenges is faced. It's like an anti-nuclear antibody.
A regular test would cost how much?
Just one test alone can go for up to about 5,000.
5,000.
Yes.
That's not something all the Kenyans can afford.
Yeah, and that is one test. Yeah, and we are
And
going
we
to
need
do
more. Many tests.
Many tests. So sometimes even when you get a lupus patient and you want to run all the tests and be comfortable to try and make a diagnosis, we can go up to sometimes 80,000 and above just to make a diagnosis.
Treatment,
and you can see we've not started the treatment. Yes.
Testing.
Yes.
Testing and trying to get a diagnosis.
That's trying to get a diagnosis. And you know, sometimes most of these outpatient covers are 100,000. And that's an outpatient cover. So for a lupus patient to get a diagnosis, just to do the tests, we've already finished your outpatient cover for the year. We've not even made your diagnosis. We have to start your treatment.
So does that then mean that we could be having several cases of undiagnosed lupus just within the populace?
Yes, that would mean so.
While on that, you can run me through the numbers if we have.
Yes.
Do we know how many people probably annually, or, you know, do we have data that would speak to the magnitude of this particular problem?
Thank you. I'll get there shortly. I think you had also asked me about the types of lupus so that people can also know that there are different types of lupus. The prototype that we talk about is this systemic lupus that we've talked about that affects all the systems. Yeah, that comes in any time. But we can have different types of lupus. You can have skin lupus alone. We call it cutaneous lupus. We can have discoid lupus that leaves you with scarring and loss of hair. We can have childhood lupus, as I had alluded to. You can have neonatal lupus, babies who are born from mothers with lupus, and usually that is a transient type of lupus. You can have lupus in the kidney. We call it lupus nephritis. We can have neurolupus, that is lupus in the brain. So we have many types of lupus depending on what it affects. When it comes to data, we do have a challenge there, and maybe that's an appeal that we're going to have today. We see a lot of lupus, and that's why we are here, to create awareness. But we do have challenges with data. We have done our own studies in Kenya before. We have Dr. Etau, who has tried to get lupus from Kenyatta Hospital. That's a while back, and we found that our prevalence is not too far from what is in the world out there. It's about, the prevalence of lupus is about 0.1 to 0.4% out there. But we do find that we had a lot of lupus here. We actually got about 50 to 150 lupus clients in a group of 100,000. And that means our prevalence is not too far from what is out there. And probably we would be having more. It's just that we are not able to test these clients. We also have Dr. Eugene, who has done studies on lupus. He tried to classify the types of lupus that we see, and we also found that in our case here, we have severe lupus. And severity could be maybe because we are not diagnosing it early. You know, we have issues with people seeking treatment early. We have lack of awareness. So by the time they come, we have a lot of organ damage there. Yes.
Winnie, back to you. You talked about fatigue, and it's real. If you've gone through that experience, you know, you can tell us more about what you wish your family and doctors then would have known on day one to save you that fatigue.
I don't know what really can be done for fatigue, because this is not your normal fatigue or normal tiredness. Sometimes I say this is premium fatigue.
Yeah,
it's another extra level of fatigue, because it does not go away whether you sleep. You know, someone will tell you, get a good night's sleep. It doesn't go away with a good night's sleep. I I think I was having a conversation with one of the doctors, and they told me perhaps there's also this lupus now that is just presenting with fatigue. Because like right now for me, I do not have those serious symptoms. I think also what has helped me is I have worked with my doctors. I have taken my medication religiously, and right now I'm at a good place. My only biggest challenge is fatigue. And this is fatigue that you cannot say that you take a break from work, take leave, rest, or just have a good night's sleep. It doesn't go away. And I think it's a serious medical symptom that maybe should be studied more so that we find out how to deal with it. But in terms of the way my family, I think I have gotten to a space where I know when to stop and I know when to carry on. I know when to just go to my bedroom
and slow down.
I can sleep at 7, I can sleep at 5 sometimes, I can sleep late, but I have learned to also just take it a day at a time, one step at a time. If I am honestly exhausted, I will take a break. So
Did you know about lupus before?
No.
You were part of the statistics. Let's be honest. That's why we are having this conversation today. There are so many people who are even hearing it for the first time.
No.
So did you know about it before? No. So tell me about the transition. So you've been told you have lupus. So how is Winnie processing this news? What's happening and how are you taking it in?
The first thing is for you to go to Dr. Google. Talk to Dr. Google and ask Dr. Google, look, and then Google will tell you,
what is lupus?
This is life-threatening. It can be fatal. You will live with it for the rest of your life. And some people die from it. Then you go to, again, you go to some of the groups on Facebook, like the Lupus America and all that. And you see cases and the way people are struggling and people are dying, and you're like, okay, so this is it, eh? We are dying from this. So it was quite challenging.
So were you there at that low moment?
I think I went through the 5 stages of grief. It was like, because, you know, that diagnosis is like, you feel like you're dead already. Because you're going to lose your good health, because somebody is here telling you that there is no medication for this. It's not like malaria. You will take those the drugs that help cure malaria and it goes away. No, you will live with this for the rest of your life. So really for me, I went through those 5 stages, denial.
So you still struggle despite the fact that you had gone through so much already.
Yes.
Not knowing what's happening.
Yes.
So here you are, you're told, now this is it. Did it change anything, knowing now what it is? Did it change anything for you? Did it change your perspective? Did it change how now you're addressing your health and your wellness?
Absolutely, it did. I became more intentional about my health, my relationships, in my family, you know, and also just told myself that the diagnosis is here. I don't think it's a death sentence for me. And for me to get to the point where I accepted, I said, okay, they have put a name to it. They are saying there's medication that can help us manage it, and I can live to my full if, you know, I take the medication. Of course, that diagnosis, you also have to adjust a few things. I had to slow down. You know, that fast life, I had to slow it down because I was very active. There are things I cannot do right now. There are things I can't do right now because I need to be conscious. Because I know sometimes if I am in a crowd, I have to be very careful because I might pick something that you have. And when I pick it, that's a flare-up. The symptoms shoot, and most of my flare-ups end in the hospital.
You know, fun thing about Winnie, she's always full of life and inspires you despite everything. But we'll get to how you got to that space shortly and what you're doing now just to empower people. But Dr. let's pick up from where she has left. Now there's a confirmed diagnosis. It's a positive case of lupus or whatever you call the outcome. What do you do next? What are the options for a patient or somebody who could be watching and maybe they are not yet a warrior, they are a patient, they've just gotten the news. They don't know what options they have. Treatment options. What is it that is done to manage? Run me through that.
All right. Once we make a diagnosis of lupus, as we said, lupus is different in every patient. Like Winnie's lupus will be very different from the next person's lupus. Everybody's lupus is different. So meaning that the cocktail or whatever we're going to start them on is very different, depending on how they presented. So one lupus patient, the next lupus patient is different. But as she has said, breaking the news about the diagnosis of lupus usually is the challenge. Because once you break the news again, we have another challenge there. It's either they're going to accept it and take the medication, or they will disappear because you have broken the news. So you make, actually, sometimes you make things worse, because sometimes they didn't know about lupus, they didn't know they were suffering from lupus. So immediately you break the news about lupus, that takes again another few years, going to different medical facilities, maybe different doctors, hoping that this is not lupus. So we waste a lot of time there. But usually our intention in treatment of lupus is to try and make it as low disease activity as possible. Because we are not yet discussing cure at this point in time, and I hope soon we'll be able to get a cure for this. But the complicated way that lupus comes, as we've discussed, has made it very difficult to get a very specific
when you're talking
cure
about
for
treatment,
it. Yeah, so when we're
what are we talking about?
So we are talking about trying to make you be as healthy and as normal as possible. What you're trying to say is to bring you to a state of remission, or to a state where the disease is as quiet as possible, to control your immune system and bring it down, to calm down. So we call it low disease activity, or what we call remission. So sometimes you can be in remission, but you're on medication and the disease is quiet and you're leading a normal life, a productive life. Sometimes
it is still there.
It is still
lupus
there.
Is still there.
Yes, you still have lupus. Yeah, so we do have drugs around. We have drugs like hydroxychloroquine. Those are foundation drugs. We call it the basic foundation drugs. We give them steroids, but we try to be on steroids for a very short time and trying to remove it as early as possible, because we have a lot of side effects with steroids. And then we have the immune suppressant drugs, which we have available. We have drugs like mycophenolate, we have drugs like azathioprine, we have drugs like cyclophosphamide. And then from there now we go to the big bombs like the biologic drugs. These are expensive drugs. We have some of them available. And what is being discussed right now is something called the CAR T transplant. It's like a bone marrow transplant, if something like that, if I can try to get something close to it, where they take your blood cells and they try to genetically modify them to identify what the abnormal cells in you. So I take your cells and I try to genetically modify them to make sure that they can go back into your body and identify the cells that are causing a problem, and then they transfuse it back. But that is still in investigation stages right now. It's still in research, though being practiced in some areas, but you can imagine the kind of technology and the level of hospital that would require. If I try to cost it in terms of Kenya shillings, that's going for about 50 M to 100 M right now. So
what do you mean?
Yes,
that is the surgery.
It's like a transplant. It's a CAR T. Yes.
That's where we are going.
That's where we are going. That's where we are going.
Invention.
That's the newest invention we have right now for lupus.
How many Kenyans can afford that?
Yeah.
Okay, before we get there.
So I've talked about the drugs, but there are many other
things. About the drugs that are there, even those, are they affordable? Are they accessible?
Yes.
Yeah?
I would say they are accessible. Generally, we would have some of the drugs, especially the oral drugs, they are available. Affordability is still a challenge. Hydroxychloroquine is a basic drug. It was quite cheap before COVID came. It was about 20 shillings a tablet. But when the COVID pandemic came and it was discovered maybe that it can be, used for treatment of COVID, the cost shot up. Most of the drugs we used in lupus, as much as they're available, remember we import most of these drugs. So sometimes we have them, sometimes they're out of stock. We still have a problem with this not being available, changing brands. The supply is still a problem. But I would say like the azathioprine, mycophenolate, we have those around. We have the cyclophosphamide. We do still not have all the biologics that I told you. That's now at another level of treatment. We don't have all of them available, but the few that we have available, some people are getting them. Yes.
When you relate very closely na Kenya nasema,
yes,
these drugs, like talk to me about the economy of lupus, the financial side of lupus. For somebody who doesn't understand the burden of this disease, apart from just the toll it takes on your body, financially, what are we looking at? And what would be your clarion call?
The cost of managing lupus is quite a big challenge for many of us. And like Doc is saying, like even the basics, and now the prices have gone high. The mycophenolate that she's talking about ranges between 90 shillings per tablet. I'll speak for myself. I take the MMF. I take 4 in a day.
For in a day?
Yes, 2 in the morning, 2 in the evening. And each is about 90 bob. So that's about
360?
360, 400.
Yeah.
And that's only one.
That's
I
a
am,
day.
I'm on other medications as well
Okay.
to top up onto that. I'm on the HQS, I'm on the steroid, the prednisolone. So for me, like if I take medication for a whole month, usually it's between 30 to 40,000.
That's medication alone?
Yes, for a whole
All
month.
these other factors you've not included?
No. We have not spoken about going to see Dr. Beryl in the clinic.
Yeah.
You have not talked about the transport.
Consultancy.
Then there is also the lab tests, because usually you do tests so that when you go to see the doctor, they're able to now see how you're progressing and see what's happening. So again, there is that. Sometimes the lab test could go between 15 to 20,000 for one session. And then, so you're looking at in a month of going to the doctor, between 40 to 50,000, or even sometimes it goes to 100,000, depending on the severity of the lupus at that particular point.
And it changes every time. So
yes, it changes every time.
You're doing better. There are days it gets worse.
Yes, because when you flare up, it's a whole different thing. The treatment changes again. And most often when you flare, and like Doc was saying, if you have even insurance, if you spend 50,000 in month 1, 50,000 in month 2, that means the next 10 months you have to be struggling. Either you pay out of pocket, or you figure out how to, you figure out something. So it's really quite costly.
Having said that, what has lupus taught you or exposed you to that you're doing? Right now you're more into advocacy. I want to know how you have turned your experience into now, trying to fill in the gaps that you have seen in policy, in cost, in whatever it is, information, what you're doing now. What are those gaps, and how is Winnie using her experience to fill them?
I think the biggest gap is lack of knowledge, like Doc had alluded to. It's lack of awareness. Even the medical fraternity itself, some of them are listening and learning about lupus perhaps today, or perhaps when they meet now someone with the condition. So number one gap is that lack of awareness. People don't know about it. And so it's also difficult to support someone when you do not know about something. So what we are trying to do, as a lupus warrior, is I'm using my story, my voice. I'm sharing my story out there boldly, confidently, so that someone who feels like they are alone because of the diagnosis, I feel like they're about to give up and feel like it's a death sentence, is for me to tell them, look at me, I am here. I am battling this, I am struggling, but I am pushing on. And then the other thing is about cost. That is something that I don't know what will happen, but it will take a lot of work from across different stakeholders so that we push this thing, because lupus is still invisible. We want to raise it to the point where it is a public health issue. It's not an issue that is put on the sides because we don't know about it. Where are the numbers? I believe even in terms of numbers, Dr. Sheila Cheng from the Liverpool Foundation is doing something very good for the lupus, and I'm hoping that with that data, we're able to again strengthen our advocacy efforts. So in terms of awareness creation, I'm part of a group of people who coordinate and bring together lupus warriors. We did an event in May during the World Lupus Day celebrations, just to create awareness. Did a wonderful walk. There were talks. In the center of it, warriors were sharing their stories, also just to encourage others. And also events like this are opportunities for us to create awareness. Again, recently there was a call for different stakeholders to come and put their issues on the table around SHA, on the benefits and tariffs package. So again, lupus warriors came together and we put in proposals to see then if the government can consider lupus as one of the chronic illnesses and actually have it covered under SHA.
Under SHA.
Yes, because I know
so there are ongoing talks with regards to that?
Yes, there are ongoing talks regards to that. But again, we are also trying within our own little spaces to support patients in different ways, to support warriors in different ways. For me, what I do is I really encourage other warriors, and Dr. Beryl is really always very good at sending people to me, because when I tell my story, then somebody else out there is feeling encouraged.
They latch on it.
Yes, looking at me and like, but if she's going through the same thing I'm going through, and she looks the way she looks, and she can actually go to work, you know, raise her family, build her career, then it is possible. Yes.
And you look amazing, Bai.
Thank you.
Daktari, you know, as we're almost winding up, what would be your clarion call? You've been in this space for some time, and there was, if I remember correctly, there were talks of having a registry, and there's a lot that's happening, a lot of research. There's a lot that's happening just to make lupus known, just to make people who come after Winnie find it easier because of the experiences that they've gone through. Tell me more about where you think we should change strategy and even change our talk around lupus. What do we do?
Thank you. We need to bring focus to this space of autoimmune disease and lupus, basically. We need basically government, we need insurance companies to make a conscious effort really to support this space of lupus, right? So we need to be supported with data. As Dr. Sheila has started us off, though we also have something else that was called the COP Code, which was already trying to collect data on autoimmune diseases and lupus. That needs a lot of support. And this support can be given from government, from well-wishers, just so that we can understand how much of this lupus do we have, how severe is our lupus compared to others, so that we can also make our own, you know, tailor-made Kenyan solutions for our lupus patients. We need also to train specialists. All right, we need to increase our training of specialists.
How many rheumatologists do we have today?
We have 13 rheumatologists.
And you know each other by name?
Yes, and 10 are in Nairobi. So 3 are out of Nairobi.
It means there are few.
There are very few.
Very few.
There are very few. So just to increase on that is just to increase the capacity of other healthcare providers to understand lupus and to be able to refer this, because as we prepare to train these specialists. We also need to support, you know, formidable groups like the ones Dr. Sheila is talking about. Because when you go to discuss at the table, we also need the voice of the patients. So we encourage the lupus warriors to have very strong groups that can be very effective and can push policy. So those are the kind of things that we're discussing here. We need to discuss bringing down the cost of the drugs of lupus. If we can be able to focus on infections, I know there's been a lot of focus on infections, a lot of focus on HIV. Everyone has come together and discussed HIV. We are now discussing NCDs. We are now discussing cancers. The drugs have been brought. The prices have come down. They've been onboarded into SHA. Right. We need lupus and autoimmune diseases to be considered in the NCD space also, and also in a very big way. Right. So that's we are trying to push in that direction.
Thank you so much. Yes. Thank you so much, Winnie, for creating time. Winnie Opondo is a lupus warrior, and the good work that you're doing, keep doing it, and all the best. Just encouraging people out there. I've also been engaging Dr. Beryl Ganda, consultant rheumatologist. Of course, a conversation that we just put a comma. Always like we will have another opportunity to pick it up and elevate awareness around lupus. Thank you so much for watching the show today. My name is Safina Chengo. It's a wrap. Enjoy the rest of your day and enjoy the rest of your viewing.
No matter how chaotic your day gets, the new Nice and Lovely Ultra Fresh Deo with zero alcohol keeps you fresh all day with 48 hours sweat and odor protection. Make moves bila jasho. Try the new Nice and Lovely deodorant today. 9 out of 10 women said they would switch.
Karibu! Leo pork ni poa kuliko mpoa wako. Na haikugost. Pork iko na selenium. Inalinda immunity. Kama bouncer.